Cameroon.
Oh, nice. I'm from Ghana, by the way.
Oh.
So yeah, West Africa.
I know Ghana. I used to work there.
Oh, really? Oh, small world. Well, so thank you very much for coming. Quite an amazing town. I guess because of the traffic. But anyway, we decided to do some lecture series. Every month we'll be having a lecture, talk about some part of the body, whether knee, back, or hips. Okay, so today we start with lower back pain or spine pain in general. Usually when we say spine pain, some people say lower back. Most of the time, some people say it's the neck or mid back. But this lecture will incorporate, even though I'll say lower back or spine pain, is going to be your neck, lower back, or mid back pain. Okay, so lower back pain or spinal pain. Okay, what causes this? Okay, most of the time we hear people, most of us are going to have some kind of lower back pain in our lifetime. Okay, back pain is no joke. Whether it's your lower back, mid back, or upper back, it's no joke because it's very debilitating. In a lifetime incidence, about 60 to 90% of the time, in one's lifetime, we're gonna have some back pain, some back or neck pain during that lifetime. Okay, the leading cause of disability in people age greater than 45 or around 45 years old. Okay, and also the leading cause of disability in age greater than 45. So the first one is leading cause of disability age less than 45, and the third leading cause of disability in age 45 and above. Okay, 80% of individuals will have some lower back pain in their lifetime. Okay, so it's very prevalent. We all will experience that this phenomenon in our lifetime. So what causes lower back pain or what causes spinal pain? Okay, besides the big things, the trauma, the other things, what is the anatomic causes of lower back or spinal pain? Okay, so one, it can be the disc, it can be the bone, it can be the nerve roots, it can be the facet joint, or it can be the spine muscles around the spine itself, or it can be the ligaments around the spine, or it can be the organs that are also around the spine. Okay, which we'll go into details of every one. Okay, so or it can be the trauma, that is associated with back injury or those other injuries as well. Okay, so we'll start with the disc. What is a disc? The disc is actually the soft tissue that's in between the bones that acts as a shock absorber. So imagine a jelly donut. Okay, imagine you have a bone sitting on top of each other and a jelly donut in between that. Okay, the disc acts like a shock absorber and also allows you to bend. Okay, this is what makes it comfortable to bend and everything. When that disc becomes problematic, guess what? You're gonna have some spine pain. So if you look, go back. If you look at a normal disc, this is a healthy disc, nice, juicy. It's like a jelly donut. And then over here, it's really bad. The disc is gone. That jelly donut looks like somebody smashed that jelly donut. Okay, so now it's gone from a healthy disc to a bad disc. So now bone cracks on bone, and guess what? You're gonna have some back pain. When you do this and you do that, any movement with flexion extension is gonna cause excruciating back pain. Okay. Next one. Also on the MRI, you don't have to learn the MRI, but if you can tell, all this white here is nice, juicy disc. All this is normal disc, but then look at this one right here. It's dark. So that one is degenerated. So that will cause you some pain. Okay. What else? Bone. Spine vertebrae is composed of bone. Okay. So that bone can also cause you pain. What things that happen to the bone, whether fracture, whether avulsion, which means something pulled off the bone, can also cause you pain. So for example, somebody falls, what happens? They're gonna have some kind of pain. Okay, so they're gonna either break the bone, have a contusion in the bone, and that can cause some back pain. So, for example, nice structure of a bone, which is a square, and then this one is broken. So definitely, it's like you have a fracture in your leg, your knee, any other parts of the body that will cause you pain in the back as well. Okay, nerve roots. Okay, so what is a nerve root? Okay, so the nerve roots are what connects our brain to other parts of our body. Okay, it's like electrical signal, just like electricity in your house. They transmit electricity from one place to another place. Okay, so if that transmission is disrupted, then you're gonna have some back pain. Okay, usually that pain goes down the leg. People feel like, wow, I have some pain shooting down my leg, shooting down my arm, shooting down some parts of the body. Well, that's the electric signal and it's being disrupted. So that's what's causing the pain. It's the same way when it rains, your house light flickers, same thing, it means something is wrong. So the same thing, when there's something wrong with the nerve, it flickers and it causes you that pain, numbness, tingling, all those other things. Okay. So usually nice nerve, spinal cord, everything is nice round, and then right here, you know, you don't need a training to know that there's something wrong with that one over there. Okay. So what else causes back pain? So sometimes the ligaments and the muscles. Okay, you don't have to know everything, but you can tell from this picture, it looks like there's a bunch of ligaments around the spine. Okay, and right here, there's a bunch of muscles that holds the spine. Okay, so your spine sits down, there's a bunch of muscles that are holding the spine, ligaments holding the spine together. Okay, so any destruction of that biomechanical process can cause you pain. Okay, you lift something the wrong way, you bend the wrong way, you twist the wrong way, that can cause you pain. Okay, so those are also pain generators, and that can cause excruciating pain in the back or neck or mid-back. Okay. The next thing is, we say, the visceral organs. Okay, so in your body you have other things. So the back and the spine is in the front with the muscles. Also right in front of it is your pancreas, your abdomen, your gallbladder. Sometimes those can cause what we call referred pain. So sometimes people can come and say, hey, I have some severe pain. It looks like I'm having pain in my back. But that can be coming from your kidney, it can be kidney stone, it can be gallbladder, it can be all those things. So all those things can also refer pain to your back. Okay. So who is at risk for back pain? Okay, we know things, we talk about briefly what can cause back pain, but who is at risk for back pain? Well, everybody, we know that everybody in their lifetime, about 80 to 90% of people will have some back pain. So who is at risk? Does the risk increases with some particular people? Yes, it does. One, smoking. Okay. We hear this every time. Smoking does this, smoking does that, but smoking also increases the risk of back pain. Imagine, remember that jelly donut that we have? Okay. Remember the MRI where it becomes black? Well, smoking makes it blacker. So smoking makes it decrease or degenerate quicker. Because what does smoking do? It dries things out and also dries the disc. And once the disc is dry, it doesn't have the biomechanical properties to absorb that shock in your back very well. So then that causes back pain. Okay. Also weight gain, okay, which is very self-explanatory. We have that disc pushing, absorbing the shock. So too much pressure, too much weight on that disc, that can also destroy that disc quicker. Okay. Next. Okay. So occupations, work. That's one thing for most young people. That's a thing we go through a lot. You know, hard labor, construction, truck driving. Even just driving back to work every day, the vibration of your car on the highway also increase the pressure, intrathecal pressure on the disc, and that can prone you to back pain. Besides that, there's also genetic component to back pain. Some people, their parents had back pain, their great-grandparents had back pain for some genetic reason, and also they could be prone to back pain as well. So, now that we mentioned what causes it, who is at risk, how do we treat this? Okay. So treatment can vary, okay? So usually we start with non-operative treatment first. Anywhere you go and you have back pain, especially here at OKC, we try to treat you non-operative treatment first. We're gonna try and do everything, and we'll talk about this later. But the first things you can do yourself is one, stop smoking. Okay, when you stop smoking, it will decrease that disc degeneration, and that will also help. Okay. Number two is exercise. Okay, so exercise is a keystone to strengthen those muscles around the spine. Okay, how do we do that? The goal is to strengthen your core muscle. Okay, the extensor muscles and also the flexor muscles of the abdomen. Okay, you want to visit with a certified trainer or physiotherapist to begin with this regimen. The good thing here at AOKC or AOK Medical Center, we have athletic trainers. We have athletic trainers that can actually visit with you and say, hey, if this is your daily regimen. Some people exercise, some people want to start a CrossFit program. The athletic trainer can meet with you and say, hey, let's evaluate your strength, your weaknesses, and then strengthen those before you start the exercise program. I can tell you, every day I see people who say, hey, I just started CrossFit, and then they come in with injuries. Before you start any exercise regimen, it would be nice to meet with our trainer or any trainer or any certified trainer and say, hey, I want to start an exercise program, but what should I do? And those trainers will work with you to go through the process. In that case, you don't end up injuring yourself. Okay. Also, evaluate your ergonomics at work. So look at your work environment. Make sure the chairs you're sitting on at work is very comfortable. At home, make sure everything is comfortable because those things can also impact your daily activity and also impact your back and neck pain. Okay. So, for example, this is one of those fancy ergonomic places to work with where everything is all set up nicely. One basic thing. Okay, if you want to know if you're working or sitting comfortably, I use the 90 degrees rule. So if you sit at home or at work, you want to make sure one, starting from your foot is 90 degrees, your knees 90 degrees, your back is 90 degrees. Okay, so that is a good start to make sure you at least you're doing some proper posture. Because if you slouch like this or that's not good. You want to make sure everything is 90. Okay, so that's
posture is important then.
Posture is very important. Posture is very important because at the end of the day, if you're slouching all the time, that can cause you back pain. If you look at that picture before, that person is already having back pain. So when they sit, they're putting, depends on what the problem is. For example, this person has disc degeneration. So when they sit upright, now it put pressure on the disc. So now they have to lay down like that. Okay, but in the beginning, it's better to sit upright and everything. Okay, so also, we always hear the term no pain, no gain, no pain, no gain. You want to avoid that term. Like I said, visit with the physiotherapist, athletic trainer, or somebody that can go through your exercise regimen, make sure you're doing things the right way. Okay, that no pain, no gain, that's not a good thing to go and live by. Okay, also, a couple of things. Here, for example, at physical therapy, they have TENS unit where it is electrical stimulation, where you put it on your skin or the muscles and it stimulates the muscle. It's battery operated, and what it does is it helps control the back pain. Okay. Also, we have a physical therapy here, and usually that's another thing, physical therapy. Most people say, well, I can do my own exercise at home, I can do my own regimen. Well, once again, you want to make sure you do the right thing. Your back pain can be coming from your weak hamstrings, or your back pain can be coming from your weak knees or weak hips. What happens is once you visit with the physical therapy, they make sure they look at your whole body, make sure your neck, your back, mid-back, your lower back, your foot, even the way you walk. If you're flat-footed, that can impact your back. Okay, so the physical therapist, we have a Joby, which is an amazing physical therapist that will look at everything, the way you walk and everything, and they can diagnose what needs to be done before you even start an exercise program or exercise regimen. So
I have a question. Can you see a therapist, a physical therapist, or an exercise? What do you call it? A trainer.
Athletic trainer. Yeah.
Can you see an athletic trainer before you have a problem for them to tell you?
Yes, I mean you can.
You guys do that.
So we have an athletic trainer here. You can actually say, hey, I want to visit with the trainer. And if you're not having a back problem at all, our trainer can also visit. Because our trainer helps with the athletes at school, and they can visit with you and say, hey, this is something. If you want to start an exercise program, you can have a consultation with our trainer, and they can decide what program you want to, what exercise program you want to do, and they can go over things with you. Because most people say, well, I want to start it first, I want to, well, the best thing is visit with them first. They can tell you, because not everybody can, the same way not everybody can run fast, it's the same way everybody can do the same exercise. So just because everybody else is doing CrossFit or that kind of exercise doesn't mean you need to do that. Maybe you
See,
don't
that's
need to do
interesting.
that.
That's very interesting. That's because you never think of it that way.
Exactly.
Like, I just bought a CrossFit gift certificate at a charity gala a couple nights ago, but that might not be good for me.
That might not be good for you.
That
might not be good for you. So our athletic trainers will do a great job of meeting with you and then find out what needs to be done, and then they can tell you what exercises. And they can say, hey, well, you can do CrossFit, but don't do this exercise, don't do squat, don't do this, don't do that. This is not good for you, or this might be good for you. So
right.
It's also good to meet with an athletic trainer before. Okay, and Megan is amazing with that. The other ways we can treat back pain or spinal pain is also medication, anti-inflammatory medication that can also help. But you also have to remember that some of this can also cause bleeding. But seeing one of our physicians or any other physician, they can monitor that. Also, pain medication. That's also has a risk for abuse as well. And also muscle relaxant, depending on what is causing the pain. If the muscle is causing the pain, then muscle relaxant will help. Okay. Then the next thing is steroid injection. Okay, it can be in the form of trigger injection where we just inject into the muscle with you being awake and injecting the muscle, and that kind of calm the pain or inflammation around the muscle. Also facet joint injections, as well as epidural steroid injection. So those also help. If the facet joint or the disc is degenerated, the injection can go around there and calm down the inflammation. For example, if you rub your fingers together all day, what happens? It gets really red and you can't even touch your fingers because it's become really inflamed. The same way when your back rubs against each other, the bone rubs against each other all day, it becomes inflamed. The steroid goes in there and calms down the inflammation. Okay. So, with all this said, how does AOKC or AOK Medical Center help somebody with back pain or spine pain? Well, the one thing we have here is we have a multidisciplinary approach. Okay, so not to say anything about other places, but if you having back pain, and it's like they say, if the only tool in your bag is a hammer, then well, guess what? Everything looks like a nail. Okay, but over here we have a multidisciplinary approach. We have emergency room downstairs, we have physical therapy, we have athletic trainers, we have sports medicine physicians. Okay, we have physicians that are dedicated to sports, to keeping somebody active. So a place like this, AOKC Medical Center, where we have a multidisciplinary approach, can figure out, hey, is this pain coming from your back, or is it coming from your foot, or is it coming from your knee? Is your knee bothering you? So because of that, your biomechanics is off and you're walking and causing your back pain. So this is a multidisciplinary approach to back pain. But sometimes people might have back pain, might not be coming from the back. Well, even though there's back pain, the back pain might be secondary. So you can keep injecting, you can keep treating the back pain, but guess what? The back pain is not going to go away until you treat the primary, which could be maybe flat feet or your shoes or something. So that's one thing that's amazing about this place, because we have a multidisciplinary approach. Okay, and one thing about AOK Medical Center is surgery is your last option. We try everything. We try therapy. We try leg trainings. We try everything. And if everything fails, and depending on pathology, before we decide, oh, okay, everything else is failed, now at this point, surgery is indicated. And even if surgery is indicated, we have different amount of procedures, whether minimum invasive or depending on the pathology. Okay. So now that we mentioned things about back pain, everything we talk about makes it so easy. Okay. However, are there dangerous things about back pain? If somebody has back pain, they're like, whoa, I've done everything you said. I did physical therapy. I saw my trainer. I'm exercising. I'm losing weight. I quit smoking, but my back pain is still persistent. Well, what do I do? Well, the rule of the game or rule of thought is: one, if you've had the back pain for more than 4 to 6 weeks and it's not getting better, you've tried everything by yourself. You've tried all your over-the-counter Band-Aid, everything that you've tried is not helping. You might want to see somebody about it. Okay, because there can be some red flags. There's certain things that can also present as back pain. Number one is tumor. Okay, somebody can have whether benign or malignant tumor that can be causing back pain. For example, if you look at here, we look about an MRI. All this is a spinal cord. Spinal cord. Right here, there's a big thing there. That's a tumor. Okay, so we want to make sure if you've had this back pain for a few weeks and it's not going away, you want to see somebody. You want to see a specialist for it. Also, it can be a severe spinal cord or severe nerve compression that can be causing your pain. If you let this go for a while, sometimes you can end up being paralyzed. So you want to see somebody about that. Okay? So, and once again, here's another one with the tumor. Spinal cord, there's a tumor. So even though back pain can happen because of your daily activities, sometimes you can get back pain for serious reasons. Okay, whether tumor or infection. So the pain is, like I said, 4 weeks, 6 weeks is not going away. You want to see someone. Okay. So, any questions at this point? What the question is to the audience. It's supposed to be more interactive. What you have any questions about the lecture, or two? You have any questions about AOKC Medical Center as compared to back pain, emergency room, our service center, or our sports practice here?
I was just wondering, have you ever recommended to a patient that they have to quit the job, the kind of job they're doing, because that's the cause of the back pain?
So, it's amazing. Most people have asked that question. One of the most common questions is, should I quit doing my activity? Like I said, this place, we are very keen about trying to get you back into your activity. So majority of the time, 99% of the time, we try to get people back into their sporting activity or whatever makes them happy. Okay. So for example, if somebody's having back pain and say, hey, I have back pain, so we say, hey, quit doing your activities. Well, now that person is going to gain weight, and guess what? Back pain is going to get worse. So over here, the matter of the fact that we are athletic practice and we're trying to get people going, we do as much as we can to get people back on the activity level. When it comes to a job, okay, sometimes it depends on the pathology. If somebody comes to me and they have severe back pain and it's because they have a tumor or something, well, that's going to take a whole different course on their back pain. But majority of the time, 80 to 90% of the time, we try to tell them ways they can address or change their jobs around, even though they keep the same job. Because some people have jobs that they've been doing all their lives. Okay? You can tell somebody, for example, somebody tells me, hey, quit being a doctor. I'm not going to quit that. I spend a lot of time preparing for that. So we'll try to find ways, multidisciplinary modalities, all sorts of things that we can do to keep you, to help you keep your job at the same time to prevent you from having recurrence of this bad thing. So to answer your question, we do whatever it takes to help you, whether it's physical therapy, whether injections, or whatever the modalities will be, whether economics, to help you keep your job. Okay, so majority of the time, no. But then, if it's something really bad that you need to, quit your job or change job, then that's a different thing.
When we go to like Home Depot and stuff, we see they kind of like make the workers there wear those things.
Exactly.
What is that?
So, most people that works in construction or those places where they have to wear belts, they have the bad biomechanics, which means instead of bending and lifting with their legs, they're bending their backs. So, for example, that's one of the things we have here. To add to the questioning, we have back braces. We have all that modalities that we can help give you to help you do your job. So, for example, someone who works at Home Depot is having back pain, constant back pain. We give them the brace. We make sure it works for them. We, custom fit that brace to that person because of the job they do. Sometimes people say, hey, I'm going to go to Walmart and get a brace. Well, you might get a brace at Walmart, but guess what? That might not be what you need. You might need a different kind of brace. So over here, we look at you, we look at your pathology, custom fit that brace so that that will help you perform your job. In that case, the brace will prevent you from bending and will stabilize your back. If you have some kind of spinal slip in your back, and every time you do this, it slips, you need a kind of different brace so that will prevent you from slipping. Okay.
Okay. I was just curious.
So, that's a good question.
Can standing for long hours cause
Yes,
back pain?
standing for prolonged period of time can cause you back pain because, as you imagine, like we said, if you put pressure on the disc, that will increase the pressure on the disc and cause you back pain. So sometimes some people you have jobs that you can't sit. So the way what I tell patients is usually try to distribute the weight. So if you stand for a while, you can shift the weight around, laying on something or change the weight. Or sometimes another thing too is take a break. If you have a job that you can take a break and walk around, sit down for a little bit, those help. But standing for a long time, prolonged period of time can also increase the pressure on your back. Also, if you stand for a long time and realize, hey, anytime I stand for a long time, I'm having back pain, well, maybe your hamstrings, your quadriceps, your knee, something might be weak. So, get evaluated, you get strengthened, and then you can stand for a long time or do your job appropriately.
What about heels? Long heels?
Sorry.
Long heels. Okay.
It's hard to tell a lady.
Look, I know.
It's hard to tell a lady not to wear high heels. Okay? Mostly high heels, it changes your biomechanics, so that can cause you pain. I have patients that they have to work, they have to wear high heels, they have no choice. So one thing I tell them to do, well, you can wear the high heels, you wear it to work, but when you're sitting at your desk, take it off.
Yeah.
Have a flat shoe. When you have to go to the bathroom or just a little walk, wear flat shoes. Then we have to go to a meeting, then you can wear your high heels. So high heels, does it cause back pain? Yes, of course it does. However, it depends on how you wear it and also making sure you don't wear it often, that can decrease the pain in your back. Because it really changes your arch. It really, really does.
I have one question. So Sometimes when I move my neck, I get
Uh-huh.
like this crunchy, like click, click, click.
Uh-huh.
Is that, do you think that could be something, sometimes it's painful? That could be something to do with a disc, right?
So, it has something to do with the disc and also the facet joint. So, you have your knuckles, for example, when you do this,
Mm-hmm.
you feel your knuckles pop, right? Okay. But if I do it again, it's not gonna pop, right? Okay. So why does your neck pop, clicks? Well, one, because you have, sometimes you have degeneration in the disc and it clicks. However, the second thing is most people don't stretch. Okay. One of the hardest work we do is carry our body around. Every day we wake up, we carry our neck, our backs, and our spine is like, carrying the whole body all day. But when we wake up in the morning, we don't stretch. When we wake up, we don't stretch, we just go to work and do things. So, without stretching, sometimes those things will grind back and forth. But the good thing to do is every morning do some good stretching.
Mm-hmm.
Basic neck stretching. First, you start from the center, go up, come down, back and forth, and do those stretches. In that case, the muscles get strengthened and also becomes flexible. Okay, but to answer your question, sometimes arthritis and degeneration of the disc can also cause that to grind.
And if you had an injury or something, right?
And you also had an injury before.
I
Anytime
had
you
a
have an
couple
injury,
car wrecks and stuff.
oh yeah,
But it came like way after. Like
Uh-huh.
a year later or
Yes.
6 months
because it
later.
really come right away. Because
Right.
if you have a car accident, or any trauma, you've all done some injury. You might have the jelly donut, okay? So imagine you do this, okay? That jelly donut is busted, or your tire. If you have a flat tire, you're driving on the highway and your tire goes flat, okay? Right away,